So look at all of you. Welcome. We're so glad to have you here for our second annual Maternal Mental Health Symposium. We're very excited to see you, and we are incredibly thrilled with the support from the community and to have you all here. The response has been overwhelming, and we are thrilled with that.
In April of 2008, Dr. Howell called me into his office and said that we were going to start a new program, and he had made the decision to choose me to lead it. And he said it was going to be treating pregnant women and women who were postpartum. And I knew little to nothing about it, and I think my state of mind was similar to that of Lauren. I just was like, I don't know what I'm going to do. I was also pregnant with my third child. So I always think of Mom's program as one of my kids because it really coincided with my pregnancy. Some of you have, when you were driving, would have seen our new building, and it's going to have up to 9-bed unit for women's, which is going to target women's specialty conditions. And those beds will be reserved for women with perinatal issues.
So I'm really excited about this afternoon portion of our symposium. When I told you about our satisfaction surveys last year, the data from the satisfaction surveys showed over and over and over again that the peer panel presentation was the most impactful part of our symposium last year. So we are really thrilled to have the people that have come here to join us today. So I want to introduce our facilitator, and then I'll let her take it away. So facilitating for us today is Naina Sodi, who's a licensed marriage family therapist. She's also the senior program therapist for our maternal outreach mood services program here at El Camino. So thank you, Naina.
Thank you, Lauren. I also want to say thank you to all of you who are present here today. This is such a great opportunity for me and the Moms program to say thank you for all this amazing and incredible and really critical work that you all do in our community in dedication to just the beginnings of motherhood, but also the beginnings of families and children. So thank you for everything you do. Also, I want to thank the panel that has been so vulnerable to come and share their stories with us. So without further ado, I'd like to just ask them to introduce themselves. So we'll start.
My name is Caroline Peregrino.
I'm Allison Schaefer.
Hi, I'm David Abramson.
Lisa Abramson.
I'm Jeff Grace.
And I'm Lauren Soriano.
And again, thank you again. So, and welcome. So just to give a little bit of background, each of the people up here has been impacted by maternal mental health and has obviously survived and gone on to do many things in their lives, and we really appreciate you being willing to share your stories with us. So without further ado, I want to give everybody a chance to tell their personal story. And if you could tell us in your own words, what was your personal experience with maternal mental health, and when did you identify what help you needed?
I guess I'll get started. Well, I'm glad that there's a lot of people here. Mine started 10 years ago. This was when my son was 1 year old, actually. So even coming here, I'm thinking, do I really want to do this? Do I really want to talk? Because there's still a lot of shame and stigma in talking about it. But I said, if I keep it, I'm not going to be able to help anybody. So I want to hopefully share with you the inner feelings and thoughts that I had that actually has not even shared to a lot of my family. So this is the first time I'm going to talk about it. So mine started in 2010. I gave birth in 2009. I think I had postpartum blues, and the pediatrician recognized it, referred me to the Moms program. The moms called me and things were better. So I did treatment. About 1 year later, this was when my son was just a little over a year old. That's when I started having symptoms. It actually started with a physical symptom where I was just feeling like I'm going to pass out, felt dizzy. I was in the ER multiple times and I didn't know why. And mind you, I'm a psychiatric nurse, right? So I should I should know, right? And I should recognize, but I did not. So one night I was carrying my little baby, and it's been 10 years, but it's still hard to talk about it. Carrying him, making him milk, and I started to have a thought of banging his head on the counter. And I said, why? What was that? Right? And I'm like, okay. Didn't think about that. Few days passed. I started to have more thoughts. And I said, what's wrong with me? Why am I having those thoughts? And one morning, suppressed it, didn't tell anybody. One morning I woke up feeling like I was going to get out of control, and felt like I was going to go crazy, and felt like I didn't know what I'm going to do. And it felt like because I was going to go out of control, I might hurt my kids. It got to a point where I didn't want to be close to knives or anything that's dangerous, because I felt like if I was close to it, that I might do something and hurt my kids. And I still didn't talk about it, didn't tell my husband. There were a lot of fear. The fear was, if I talk about it, they're going to take my kids. And I don't want to do that. So kept going, kept working, doing a lot of things until my body said enough. I actually developed a thyroid condition because I guess it was a heightened stress. And that's when the doctor said, you need to go on disability, a short-term disability, because your thyroid is just way, way bad. And symptoms got progressively worse. And I actually called another psychiatrist who I worked with, Dr. Samaraga, and told her this is what's going on. I spoke to her, and she decided, yeah, you need to go on disability. And then one day, on my way out on disability, Dr. Dami recognized, hey, what's going on? So I spoke to her, and she pretty much saved my life and said, you need to go. She said, you need to go to the mom's program because you're going through postpartum depression. I said, it doesn't make sense. It's been over a year, but that's what started for me.
Hi, my name's Allison. And let's see, mine started, I guess, about 8.5 years ago with my eldest son. So midway, and again, there's so many different, and I think this is what I kind of wanted to point out, was there's so many factors and kind of that ripple effect that Dr. Beck was talking about, where it started in mid-pregnancy, where I'd had a migraine, and they then kind of questioned as to why I was having that, and then I kind of, it like steamrolled into, oh, you might have hypertension, and then that kind of, I recognized that as kind of clicking in my head of this anxiety that I never really known I'd had, but this whole experience made me recognize that I've had it since I was a kid. And then really wanted a natural birth, was doing really well, thought it was great. And about 24 hours into it, they just kind of suddenly stopped and said, we have to have an emergency C-section. And again, that was another moment of like, wait, what? And so I went in. That was really traumatic. I don't really remember a lot of his birth. All I remember is seeing my mother-in-law holding him when I woke up and just devastated that it wasn't me first. And then probably the second night in the hospital, something else just kind of clicked where I woke up and I looked over and I thought my son was, I thought he was kind of aspirating, or I don't know, I mean, I'm not a physician, but that's what I thought in my head was happening. And I looked over and he had little bubbles coming out of his mouth, and that would just set me over the edge. And from there on, it just kind of steamrolled into being incredibly anxious about his safety. And what I'd heard about depression was that you were either sad or just didn't care about your baby. I was obsessed with him. I couldn't sleep when he slept. Everybody kept saying that, which was the worst advice. I just would stare at him. I was constantly worried about walking downstairs with him when you kind of mentioned the knives. For me, it was kind of things accidentally happening to him. I stopped leaving the house because I went for a walk with him once, and I was convinced that this gentleman that was just walking down the block, I'm sure he was a really nice guy, I was convinced he was going to rape and follow us home, and I ran home in the stroller, and then I wouldn't leave again until someone kind of forced me. So that was kind of the beginning of it. And then it all kind of dovetailed into this one event. It was actually the night before my birthday. I've been having these dreams where my son was, in particular, stuck in like an upper corner of our room, and I would kind of wake up and bolt out of bed. And this one night, all I remember is having a dream that he and I were falling off a building, and I distinctly remember thinking, if I take the fall first, I'll save him, which doesn't really rationally make sense, but that's what I thought. And we had a low bed, and I just remember waking up screaming, and I had basically flung myself into our wooden floor, broke my neck. Not broke my neck, what am I saying? Broke my nose, had a gash. It was a horrible scene. And meanwhile, my son had this whole body rash. So we go to the ER. They are very suspicious of our situation, kind of separate us, ask me what's going on with my son. And I told her, and kind of my whole point with my whole story was there were so many missed opportunities that I was fully telling everybody these dreams that I'd had. And the ER, and she didn't do anything, just sent us home. The next morning, I had an appointment with our PCP, who said, "What's this?" and looked at my broken nose and everything. And I said the same thing again. I've had these dreams, and I don't fault him at all, and I don't want to appear to, but he just kind of left it at that and said I might have sleep apnea, and so he sent me for a sleep study. Which, for someone who was obsessed with her son, it was just the anxiety of working up to having to go overnight with him. I didn't sleep, so of course I didn't have sleep apnea. So that's all that happened. Was I went to the doctor and he's like, "You don't have it," and I was like, "Okay." And again, I told no one. I mean, my husband knew, but I wasn't sharing it with anybody. And so it just kind of kept progressing. But then we got this big opportunity. We're from Texas, and we got this opportunity to move here. So I kind of was able to shove it away. And then had to go through the move, and that was pretty traumatic in and of itself. And it wasn't until I got here and started to just kind of, then it just kind of kept sneaking up, those anxieties of not wanting to take him anywhere, not wanting to go anywhere. And it wasn't really till I met my friend Cheryl through a mom's group that she had shared that she was volunteering with PSI and had begun this website, and then that was kind of the person that I finally went, "Oh, this is normal. This is what I have." And I did all this research and kind of finally got on my path to recovery. But it took about 2 years. So that's my story.
Thanks for sharing those stories. So I'm Lisa's husband, and also I'm the father of our 2 girls, and I guess we could maybe tell the story in tandem from slightly different perspectives. Lisa can probably tell it much better than I can. But from the point of view of husband, and not having the first-hand perspective of what Lisa went through. 5.5 years ago, Lisa gave birth to our daughter Lucy. I remember the first 2 weeks were pretty euphoric. There were some challenges, feeding Lucy and her, putting back on the weight. But overall, we were really just excited, thrilled to be new parents. And after 2 weeks, like a lot of dads, my paternity leave had run out, and so I went back to work. And from that point, I started to notice some just differences in Lisa. When I would call her up from work or when I came home, there's a lot of tears and crying about some things that were what you would expect to cry about, some things not. I think a growing sense of kind of hopelessness about a lot of different things. It kind of shifted from her being sad a lot of the time. This is about 4 weeks after her daughter was born to Lisa starting to say strange things or not totally getting what I was saying. There's kind of like a communication barrier. Wouldn't kind of get the meaning behind a joke or a sarcastic phrase, and having to repeat ourselves over and over. And she was just really had trouble engaging, communicating with her. And so we grew increasingly really concerned as a family. We're lucky we have 6 of our daughter's grandparents in the area, so there are a lot of parents involved, and we were all kind of getting more and more worried about Lisa. And she started to talk about things that were just unusual. Kind of abstract theories and beliefs about things that were going on that clearly were not. And at a certain point, Lisa became really fixated on the story she was starting to tell herself, which later on, in retrospect, we kind of interpreted the symbolism, but she was really worried about a nanny that she thought had hurt her daughter, but actually she had just been changing a diaper. But she kind of weaved this whole story that the nanny was getting in trouble, but it was actually Lisa's fault, and that Lisa started to feel really guilty about this whole story. And us as a family we realized that there was a disconnection with reality. We sought help from a psychiatrist, just using Yelp because we didn't know what to do. We kind of got I'd say a pretty poor match with somebody. Maybe that was due to the way that we went about it and just the urgency that we tried to find somebody. But there was one interview with a person, then the rest of it was sort of over the phone haphazardly because the person was too busy. So we're kind of like on our own as a family, trying to understand what was going on. I think in the beginning we wanted to believe that we were Googling and these symptoms. We were really hoping, this is like only postpartum depression. But as Lisa's behavior just became more and more like kind of different from what we were used to, we realized like this actually could be psychosis. And at that point, there was one morning where Lisa was talking about that the nanny had been blamed for a crime that she didn't commit, and Lisa should take the fall. And then she said, I should just jump off the Golden Gate Bridge. And then for us as a family, we're like, okay, this is like, at this point, this is a red flag, and we needed to go to the ER and to get more attention, more medical attention. I had to trick Lisa to go to the hospital. I think I said, okay, I'm going to bring you to the police station. We're gonna bring you to. Yeah, she was excited. We were just like, okay, this is going to be some kind of resonance, because there's all these feelings of guilt that were kind of manifesting in the story. So I tricked her into going to the hospital, and it may have been a mistake in my tactics, because later on, Lisa was like, during all the psychosis, she kind of believed that she was in jail. But we ended up having to enter Lisa into this inpatient program up at CPMC. It was not a good experience, but it did give her the time and the medical attention to finally be able to come out of it. And she can tell the rest of the story, but I'll say, from my perspective as a spouse, it was just terrifying to the prospect of losing, your wife. At the time, I didn't understand what this was. I didn't understand, that in a lot of cases, there can be a full recovery. Like, I didn't understand all that. For some period of time, I was like, completely in shock and pretty desperate myself. In addition to, kind of having to, take, full care of our daughter, and then also take care of Lisa and a number of other things. But it was definitely a whirlwind of an experience. But since then, we've learned a lot from it and grown a lot from it. And Lisa can tell a whole other side of the story.
Thanks, honey. I wouldn't recommend postpartum psychosis was a way to get a very involved and capable husband and partner, and because he took 100% responsibility. It's not the way I would do it, but it was one side benefit of this experience. So as my husband is incredibly capable and amazing with our girls. So the things I'll share about my story is that there was, things like in my birth didn't go exactly how I had wanted. I ended up laboring for 14 hours naturally, and then getting an epidural and feeling kind of like I failed, even though I knew rationally I shouldn't feel bad about this. It was okay. It wasn't the way that I wanted it to go. So there was that at the beginning, and then my daughter was losing weight because I was trying so hard to exclusively breastfeed, and where my mom, I remember her comforting me, being like, babies in other countries, they're not weighing them every day and they're doing okay. Like, why are you needing to weigh her all the time? And why are you so nervous about her not gaining weight? But for me, it just felt like failure after failure. So those are sort of some of the early warning signs of just feeling like I wasn't good enough. I had gestational diabetes in my pregnancy, and I remember they gave me a screening for postpartum depression, the Edinburgh screening, and I was like, and they also gave it to me with no conversation of why I was getting it, and they just said, well, we need you to take it because sometimes when you have this, then you can get postpartum depression. So it wasn't reassuring, it wasn't comforting, and it did make me feel like, well, now am I going to get it, or what does this even mean? Why am I getting screened now? Again, that experience, feeling like I wasn't doing a good job, like those were all the themes of feeling like I wasn't good enough, and then for me, and then it was not being able to sleep. Even though we did hire a night nurse because I knew that I needed to get some rest, I couldn't rest. I mean, I'd lay my head on the pillow and my mind would just go wild, and I didn't sleep for 3 days, and that was when I really broke with reality, and for a moment it was beautiful. I was in a manic state, and I thought I was talking to God in the bathroom at night, and we had a wonderful time, and then all of a sudden it went into paranoia, and it was frightening, terrifying. I thought there were snipers on the roof. I thought the police were coming to get me. I mean, I was so terrified, and then ended up going, thinking it was a rational, great idea to ask my family, should I go jump off the Golden Gate Bridge? I was like, point for Lisa. She's asking great questions today. So, I was very not with it. But thankfully, after a pretty bad hospitalization experience in San Francisco, I was able to find my way to the MOMS program. And I'll stop there.
Well, thank you. I'm Jeff, and I'm Jamie's father. And I'm going to preface what I'm going to say, that I did talk to Jamie about this, and she told me to be open, honest, and upfront with her experience in postpartum condition, and so that others can learn from her experience and not to hold anything back. And she's not embarrassed because she knows it wasn't her. She knows it was the hormones. So with that said, a lot of what I was her support person. And a lot of what was just said by the other mothers up here, Jamie went through many of the same things. I noticed Jamie's condition, I would say, started the first day her child was born. Jamie's normally a very calm, pleasant, enjoyable person to be around. And the first day I went in there, she was tense and frantic and just not the person that I knew. And this progressed over the next 5 weeks to being more tense, issues with the breastfeeding, issues, with her child and not gaining the weight that she wanted, and just, like I said, a lot of the same things. And this just progressed to the point where she just really wasn't right. And to the point where then finally her mother had to keep going up and helping her out and helping her with the baby, and she wasn't connecting with the baby. And then finally to the point where she started having some suicidal thoughts. And at that point, we brought her back to our house to stay with us because we did not want her to be alone. And then about a week later, she just really hit rock bottom. She was having suicidal thoughts and wanted to act on them. And at that point, clearly she was in crisis mode and something had to be done. And at that point, I was kind of in crisis mode because I had significant fear, and I was scared, I was uncertain, and horrified. I never encountered anything like this before, and I had no clue what to do. And normally I'm kind of the go-to person. I'm the answer man. I always can figure things out. And in this case, I didn't know what to do. I was really terrified. And I was just blindsided by it. And I've had friends with mental issues, but primarily substance abuse issues. And this was just completely different. So then, we started reaching out to the medical world, and what are we going to do now? And unfortunately, we weren't really giving a lot of clear direction on what to do. We were sent to an emergency room that had no mental health abilities or capabilities, and they even said, "We're not sure why they sent you here." And this surely heightened my anxiety and my fear and concern, because now I'm thinking we're going to go get some help. And instead, I'm finding out we're not getting any help. And so after a while, we did see a social worker, and she let us know that they were looking for a bed in some hospital. I said, what about this hospital? She said, oh, no, we have no mental health capability here. I'm like, okay, great. And so after 11 hours, they found her a bed up in San Francisco, and we're in Redwood City. And so she was there for 11 hours, and no medical treatment, no medication, nothing. And at that point, I found out there's a severe mental health issue in the Bay Area, California, and I think the United States, that a lack of capacity to handle people like this. In the first hospital, they tried, but their primarily reason for her being there is just to stabilize her depression and her anxiety. The majority of the people in there were substance abuse people. Patients with nothing like my daughter was experiencing with postpartum depression. And the staff there really had no capability as well to deal with it. And I don't fault them. They did what their job was, which was to get her stabilized so she could be discharged. But then the scary part then again was, well, what are we going to do next? And we were not being given very good options. Our medical provider was saying, start going to once a week group therapy. And I'm like, no, absolutely not. This is not the right solution. So fortunately, I have a friend, Jamie and I have a very good friend. She's here today, Amy. She's over here. And she's a social worker. She's a child advocate. And so I reached out to Amy. I said, Amy, could you check with people you know? And she did. And she networked out, and they networked out. And pretty quickly came back. There was a program at El Camino Hospital in Mountain View called Moms. And so I researched it online. And when I looked at it, I said, this is it. I mean, describes exactly what my daughter's going through. And on there was a case study of a girl named Lisa. And and I printed it out and I took it up to my daughter, who was still in the first hospital, still trying to get stabilized, and she read it and she goes, gee, Dad, they've already done a case study on me. And I was like, it was right on. It was exactly everything she was experiencing. So clearly for us, Moms was the right solution. Jamie agreed it was the right solution. And once in Moms, it's just been uphill, good uphill. It was in the right direction. And she's good, she's improved, and she's back to being Jamie, and she's enjoying her baby now.
Hi, my name is Lauren Soriano. As I mentioned earlier, I'm a survivor of peripartum psychosis. I told myself I wouldn't cry, but I'm going to stay strong through this. So I have 3 kids, all 15 months apart. Don't know why I do that. Now I know. My first 2 pregnancies were normal pregnancies. No issues with mental health. I have no prior history of mental health. So that's why my husband and I thought it was a great idea to just all have the babies as close as possible. Why not, right? So we got pregnant with our 3rd baby, and just from the beginning of that pregnancy, it just felt different than my first or second, and I don't know why. And throughout the pregnancy, I had more severe symptoms, I was very sensitive to light, I couldn't even be outside. Even with sunglasses, it really bothered me. And having obviously 2 younger kids, I wasn't getting any sleep. And I didn't have any help with my children. I was very prideful. I didn't want a nanny. I had stepped away from my job, so I was like, okay, this is my responsibility. So I was trying to raise 2 young kids as I was pregnant with my 3rd. And slowly the sleep deprivation continued. And I would say where it escalated was we went back to North Carolina to visit my husband's family, and I could not sleep. I was so tired, but I could not sleep. I remember laying in the closet on the ground trying to put the pillow over my head to get some sleep, but it would not, I just couldn't fall asleep. And we ended up coming back home, and so I was almost 8 months pregnant at the time, and things went from bad to ugly to a living nightmare very quickly. So I think that the question that she had asked, how did we know when to receive treatment? And our nightmare became reality quickly. I was up for almost 72 hours straight, not being able to sleep. And I remember looking at Ray, my husband, saying, I think I'm going to kill myself. And, sorry. And then I was so delirious. I said, am I dead? Did I already kill myself? I was so out of it. And some of my symptoms, too, leading up to that was I was very paranoid. I started to become more paranoid. Ray's the love of my life, and I just started to hate his guts. And I'd write things down and just try to connect the dots, well, what you just said didn't make sense, almost just interrogating my husband every day, and very paranoid. And I remember writing it down in a notebook, trying to connect the dots, and I've since thrown away that notebook because it brings back too many negative memories. But yeah, that was the start of moving quickly from, bad to a living nightmare. And with my sleep deprivation, I just started to become more delirious, more out of it. And then then I was kicked into a full psychotic state at that point. I was almost 9 months pregnant when I decided I wanted to run away. And I think I took a taxi cab to the airport. I bought a ticket to fly somewhere, but I didn't get on the plane. I got back into a taxi cab, and I ended up throwing my purse out the window on the highway with my phone in it. And at this point, I had gone missing, and my husband didn't know what to do, Ray, and he was told by his friends, like, the best thing to do when someone goes missing is to tell the newscasters to get it on the local news to try to find her. So I was that missing pregnant woman on the news at one point. And as I share this with you, it almost seems like it's made up. It's like, that did not happen, but it did. And when I had gotten into the taxi to take a ride all the way down to Palo Alto, again in a psychotic state at this point, I somehow got out of the taxi cab at some McDonald's and called my brother to let him know I was there, and then I hung up the phone. And then at that point, I had jumped in front of a car. And yeah, I was 9 months pregnant at that point, and I was on the ground. I remember flashes of it, and I remember just the woman getting out of her car being like, I hit a pregnant woman, oh my God. And shortly after, I was picked up, and again, I was so out of it at the time, and they took me to the hospital, and I just remember them saying, this woman, the baby's in fetal distress, she needs to give birth. And so I ended up giving birth to our third child. His name's Tyler, and I had a hairline fracture on my pelvis from getting hit by the car. And I wasn't really there when I gave birth to him. Neither was my husband Ray. My mom was there. They were just so thankful to having found me. But that was what led us up to our psych ward experience. But yeah, that's a little snapshot of what happened on my end. Yeah.
I deeply appreciate the vulnerability, the courage it takes to tell our story. And we share this in our program with our moms every single day of how much courage it takes. And I really appreciate all of you to be able to say that in front of so many strangers. And also the courage that it takes to receive the story. So I want to thank all of you for listening and for all the empathy that we see in the faces, to also be able to take a moment and realize that all of you do this work every day and help people in situations like this on a daily basis, or contribute in some sort of way to help people. So thank you for that, and thank you for sharing your story. So I want to shift a little bit of focus to the support people on our panel today. And just, maybe share a little bit about whatever some of the challenges you faced in getting help to come to this place, and just being able to receive the help that you needed. You want to go first? Okay. Jeff, do you want to go first?
Oh, yeah.
Sure, I'll go first. So as a support person, I encountered really a couple significant challenges, and the first was the patient. She was very resistant to addressing the issue. She was afraid they were going to have her baby taken away from her. She was going to be put in the hospital, all these things, and I can understand, but she did not want to admit the magnitude of the problem. She was afraid her baby would be taken from her, and she did not want to take her medication. And in some of the previous presentations, there was discussions about breastfeeding, and she was getting really uptight about that. If I take the medication, I can't breastfeed, and it was just cycling. I mean, it was just going in not a good direction. So that was probably the number one challenge. And then the number two challenge was, once we did finally decide something had to be done, is getting medical attention. And as I said, I didn't know what to do. The initial, solution was the emergency room, where there was no mental health capability. And then, once we did identify the MOMS program, Jamie encountered, and I encountered, a lot of resistance from the medical provider to release her into the MOMS program, because they were not part of the network. They wanted to, I said, attend once a week classes, which clearly was not the right way. But I'm a pretty persistent person, and again, our friend Amy, pretty persistent person. We're both East Coast people, and we don't take no for an answer. No is just a temporary setback. And so we pressured and pressured and pressured until the point where, when Jamie said, "Do you need to talk to my dad again?" They said, "Don't have your father call here again." But we got the release into the MOMS program. And I guess the summary is, it really shouldn't have to take that kind of action to get the people the right help they need.
So yeah, also as a supporter, navigating the healthcare landscape in the midst of somebody really important to you, suffering and having a newborn baby. I'm hoping in the last 5 years, some of the resources online and elsewhere have improved, but at the time, essentially, even though I know maternal mental health issues are relatively common, there's not a lot of ways to find out how to get help. Providers are not easily found. I've probably called dozens of people with a notebook, networking, asking what is out there. When I encountered the MOMS program after speaking with a therapist who led a support group for new moms, and I heard about this, it was like a godsend. It was I couldn't believe that this program existed. And then when I called up El Camino and found out there was actually a spot available, I just thought all of a sudden everything was falling into place finally. I will say that when we went to the ER, and we eventually got transitioned over to the inpatient unit. This is I think a day before a long weekend, right before President's Day weekend. All the kind of experienced doctors were out, and so there was a first-year resident that was receiving Lisa, and I was trying to explain that I think Lisa might have postpartum psychosis, and he's like, "Oh, I gotta look that up. I don't know," and. So that's kind of the world that we live in. I think this group obviously accepted, and I think there's so much more that we can do to broadcast and to educate everybody around us, because this place maybe is an exception, even in the Bay Area, where you'd think that we would have world-class healthcare. It's really challenging to get the help you need in the time that you need it, and every day, an hour sometimes can matter. That's the situation for us.
Thank you. I want to step away from the story. I think in the larger context, one of the things we've noticed in the program is just how much repair we have to do towards just letting people know that it's okay to have postpartum. And so I think as panelists, I would like to know what is your sense of the stigma around maternal mental health?
It's huge, definitely. I still, like what I said earlier, it's still, in my mind, I'm like, am I really doing the right thing, right? I'm coming here talking to a lot of people about, what I experience. Is there going to be someone who's going to say, oh, she had that, So I think it's huge, and there's still a lot of women out there who still don't understand it and don't really want to get help because of that fear of being judged, and fear that their children will be taken away, and fear that you're going to be stripped off everything, pretty much, of who you are as a person and everything that you worked for. So I think that's still really big. There's still a lot of work that needs to be done every single day by every one of us, I think we just have to begin by talking about it, just like what everyone else is doing here. Because if you do talk about it, then everyone else might be open to talking about it.
I mean, I would agree completely with everything you said. I know that personally I felt that stigma, which is why I didn't really share much with anybody outside of my husband. And then after moving here, and Cheryl and I run Supporting Mamas, and that's part of the reason we did that was to address that stigma and to just talk about it and be that safe place that can say this is absolutely common and you can get better. But anecdotally, through even my family who knows what I do, whenever I would talk about specific aspects of my own story, it's like a blank wall. They don't acknowledge it, they don't say anything, and now I've just kind of watched every time. But what's been really neat is to see my own dad, who's always been my biggest proponent, but I think mental health really just kind of terrified him. We were in a conversation with a gentleman this summer, and he shocked me and turned around and said that he's learned so much and kind of just started spewing these facts that I've been saying for years. So I feel like in my own life I'm seeing little bits, but then still, I mean, a family friend just last week referred to it as moody mothers when we were sharing our organization, and it just broke my heart. But it was a great opportunity to educate him. So yeah, and that we did, didn't we, Cheryl? So yeah, I think it's huge, but I think just talking about it, and in my own example, I think my own physicians that I was talking to that had their own biases, and that's just one plug that I wanted to make of just so many missed opportunities based on our own personal biases or whatnot, could have made a huge difference, at least in my case, and I think I could say the same for everybody up here as well.
Yeah, absolutely, and exactly what you guys said, and I'll add to that. I mean, that's a big reason that I've been sharing my story, because, it is important. We aren't what happens to us, we're what we make of our experience and who we become. And I do believe I've become a stronger, more confident, and a much better mother. Although I wouldn't want to have the experience again, it was transformative. So I think, sharing stories is so important to help reduce the stigma. And anytime a friend tells me she's pregnant, the first thing I say is, congratulations, and you should definitely meet with a therapist while you're pregnant, because it's important to just establish care. Maybe you don't need that care, but you should have someone that knows your baseline and that can be your support system, because I certainly wish I had had that.
And just to close things up at the caboose here, you guys are doing a great job. I'm so proud of you. To tie into the stigma piece, just as I had recovered from peripartum psychosis, I remember just being so terrified if people found out. And it takes a while to recover. It takes, over a year to feel like yourself again. And I just remember being nervous that, are people going to think I'm crazy? Like, am I going to always have that tag for the rest of my life? I'll be the kid's crazy mom. And I was really embarrassed too to go outside and converse with parents in the neighborhood, because I was scared. And while too I was still trying to digest what I had just gone through. So it made me feel even more alone. So I hope that people like us sitting up here sharing our stories, I hope that more of this starts to happen, so people don't have to suffer in silence and feel ashamed of themselves. So, yeah.
Thank you. I think this is a big part of a lot of the work we do in our program, and I really appreciate everybody's presence here today, because that, to us, is the thing that takes it to another notch, is to be able to create resiliency around the difficulty in some of these very difficult cases. So just to the entire panel, what would you want other moms or women to know that would help them seeking treatment? Anything that you learned in your journey that you would want them to know?
So really important is for both providers and maybe family or moms. A lot of providers confuse postpartum OCD with psychosis, And when a mom says, "Oh, I have a thought that I'm going to hit my son, on the wall or something, or stick his eye with something," then they go call 911 and put them, in emergency. Postpartum OCD is not a psychiatric emergency. Postpartum psychosis is, and the difference between the two is postpartum OCD. You've got these thoughts, but you don't like those thoughts. You're scared of those thoughts. I actually got to a point where I said, I'd rather kill myself than kill my kids or hurt my kids. And I've never gotten suicidal, but that time I did because I want to protect my kids from me. And so that is postpartum OCD, because I realized those are bad thoughts and I don't like them. And usually the mom wants to protect the kids from that. Postpartum psychosis is when there is that thought, but there's a delusion attached to it, where I have a thought of putting, I just don't want to be graphic, but, things like that, and they think, oh, it's because the devil, got them, or, that's just different. And so I just want to, put it out there that those are two different things, and mom should not be, because I think there's something that happened back not too long ago, I think a year ago in Sacramento, where mom talked about it in her OB visit, and she was, right? And so she was, 911 was called, and, she was pretty much condemned. So I think that's something that is very much important for everyone to know. Yeah.
Well, I mean, I think, and again, this is a lot of these are what you consider cliches, but I wish someone had told me, and someone did eventually tell me, that it wasn't my fault. It wasn't something I did. I wasn't a bad mom. I wasn't crazy. I mean, all those cliches, but that's how I felt. And I felt like clearly there was something I had done to bring this on. And then I think you make a really good point, too, about kind of knowing the difference, because I had those intrusive thoughts, and that's why I didn't want to share them, because I thought for sure someone would do something with me or with my child. So I think a lot of it, too, is kind of educating yourself and knowing and advocating for yourself. And I kind of hate to say that women have to do that, but unfortunately I think in many instances we do. And just kind of knowing the difference and being able to talk about our symptoms, and because in many cases you might know more than your provider. Not completely, but in my case, I kind of knew something was wrong and they weren't listening. So I think that's it. Yeah.
I guess I'll answer the question maybe in the light of, what I would share with other dads and family members is that I think, the family supporters have just a huge part to play in recovery. Rebuilding confidence is such an important part of, the emergence out of some of these acute phases. Just stick with it, be patient, be creative, and just persistent, and, telling your this new mom what a great mother they are, and all the great things that they do, and look for any compliment, and any way to build confidence over time will play a huge part. And so I think dads can play a big part if they kind of know what to be doing.
Yeah, I would echo that, it's not your fault. I definitely felt like I did something wrong, and that was why it happened to me. So that guilt was very real for a long time. And then also I remember Dr. Dami telling me, this is only temporary, and, it's treatable. And I was not convinced that it really was something that was temporary. I thought this was a life sentence, and this was the beginning of it. So, reminding moms these stories of hope, because I know when I Googled postpartum psychosis, I didn't like what I saw, and I wanted to have some stories with happy endings up there on the Google searches.
Just to echo what the others said, it's not your fault. It's a chemical imbalance. It's nothing to be ashamed of. And I would encourage mothers to don't hide it from others. Be honest with others. Let people help you. You have support people around you, your family. Let them know, because hiding it is only making the problem worse. My daughter felt like she was being weak by admitting to it. You're not being weak. It's not you. and my daughter is really like the last person I ever thought would have this. And it can happen to anyone, so it's nothing to be ashamed of. And once you do get on the right program, follow the doctors and therapists' advice and direction, even if you don't like it, because quite frankly, you're not really thinking straight. And what they're telling you is the right information. And you have to believe. I had this conversation every single day with my daughter. You got to believe when you're down, you're in the right program, especially once we got her into moms. You know, every day you're in the right program. Believe in it. Keep your head up. And, you know, at first, you know, it seemed like 8 weeks was going to be forever in the mom's program. It went by really fast to the point where when Jamie was done, she didn't want to leave. You know, she liked going there. She liked the people there, and she's completely healed now. And the final part of that would be is once you do realize you need the help and you get the help and you're successful, there's a program plan to follow and to follow the plan. And luckily, Jamie, every week she checks her plan and makes she's on plan. And that way you'll ensure success.
And you guys already said a lot of what I would have said, but I think a key point is to make sure the mom knows she's not alone, because it can be very isolating. So, and I had to give a shout out to Lisa up here during my recovery. She really was that light at the end of the tunnel for me, knowing that, you know, this can happen to anyone. So that you really helped in my recovery. And then just with other moms, I think it's important to point out that recovery isn't linear. During my recovery, at least, you know, there were a couple times where I refused to take my medication. There was a couple times when I took a lot of my medication, a little too much medication. So it can be a long journey for the family, for the mothers, but just to remember to try to stay on track, listen to your doctors, and that you can come out on the other side, believe it or not, but it can be hard as you're going through that to believe that. So,
Thank you. I want to echo so many of the things all of you said, because as you well know, those things were said back to you as well. So thank you for remembering all of them. So I have one last question, and I think this might be our shortest answer, is if there's one thing that you would want to share about your journey with providers, because this is really a large group of people, most of them are providers, what would you want them to know?
I think it's really being open to asking the mom, how are you? Really just saying, how are things going? Because just think about it, the mom creates organs of those babies, right? For 9 months. None of this men can do it, right? Just saying. So we're creating organs for 9 months, and after we give birth, you know, it's traumatic, no matter what it is. It's physically traumatic. So I think it would be really, I mean, it used to be, oh, everybody can do it and it's okay, but I think providers need to realize that it's very both emotionally and physically traumatic for a woman to go through that, and it's not always the baby that always has to be in the center. Mom always has to be the center, because there's a lot of studies now that says if mom's not well, baby's not going to be well. And if you want to protect our kids from mental illness, you got to protect the moms. And I think that's huge.
I think in my case, it's, again, based on my own experience and then just in the work that we do anecdotally, just asking her and saying, tell me more. And we wear these buttons that say 1 in 5 and with the hashtag Ask Her, simply because oftentimes just asking is that door that says it's okay to talk about it. And I know oftentimes people might feel fearful that they don't know where to send her, but you know, there were some resources that were shared. We're a great resource as well. So if you feel uncertain about what to do and you're afraid to ask just based on what she might say afterwards, there are places to catch you, and we're happy to help as well. But I think if someone had just said, tell me more about that, tell me more about those dreams, that could have been huge. So just being open to asking and having that conversation.
I would say, first of all, make yourself, if you're a specialist in this field, first of all, thank you. It's like so important the work you do. And if you're not, if you can network and learn who are the resources out there and be very generous and unassuming to try to bring potential patients that may need these people, refer them that way, please. Second, I just see so much of a spectrum of kind of like bedside manner, I would say, for different kind of providers depending on their specialty. And I think that it's pretty easy for somebody to shut down or to not communicate with a provider if they don't sort of feel the right rapport. So I just say, like, always be kind of sensitive and introspective about that, because I think that impacts the quality of care that the patient's getting.
Yeah, to echo that, although I was, in an altered state, I would want the providers to know, especially in my inpatient unit, that I didn't become stupid overnight. And really, I wasn't told ever what my diagnosis was. It was not until the 7th day of my inpatient experience, till my husband brought a printout from PSI that said postpartum psychosis, this is what you had, and that was the light for me. There's a name for this. I'm not alone. This has happened before. Maybe there's some hope, but because I wasn't communicating, frankly, because I was scared out of my life in this inpatient unit, there was a person who in the next door to me thought he was a dog and was living in a dog crate. I mean, I did not feel safe, and I stood out there, and it was terrifying. So I wasn't speaking to my providers, and they thought I was a pain in, the behind patient, and I was, but I still was there behind that shell. And so you just bringing that compassionate care, even if your patient is disconnected.
Okay. I would say, and just through our experience, when things had seemed off with me when I was going through my psychosis, my family was calling into my OB saying, something's not right, Lauren is not herself, we need help. And we were told by my OB that she doesn't do psych. And that was the end of it. And then that's when our situation went from bad to darkness very quickly. So my recommendation would be to, if you have family reaching out, husbands, wives, take it seriously. They're not, making this out of thin air, and, they spend most of the time with the mother anyway, so they're probably more likely to notice when things are off. So just please keep an open mind to approaching a patient and listening to everybody. And, if you don't do psych, okay, maybe then put them in that direction and give them a specialist that does, so they're taken care of before it's too late.
Yeah, I would say, make an early, correct diagnosis of postpartum depression. And there's varying magnitudes of it, from mild to severe, and my daughter had severe postpartum depression. And do an in-person analysis, not remote analysis via the phone, which is how my daughter was being diagnosed. And until she went to the ER room, she never saw a doctor. And realize that postpartum depression is not the same as all other depressions, so you can't treat it the same way. You do need specialists, as was said earlier, and like the MOMS program has the specialists in place that specifically address the issue, and not some generic group therapy group.
Okay.
So I wanted to give our audience an opportunity. We have just 1 or 2 more minutes if there are any questions from our audience for our panelists. Thank you.
Hi, my name is Stan Fishman. I'm a child psychiatrist, and I'm absolutely fascinated by this discussion today. I was very interested in the fact that everybody here reported that they were afraid that they would lose their children. And I wonder if CPS is involved in any way, the Child Protective Services, because that scares the heck out of anyone if they show up on the scene and they don't know what they're doing. So I just wondered, does MOMS approach the CPS locally or whatever? And maybe that's something that needs to be done. Thank you.
So I'm going to answer that as far as our program is concerned. I think we as therapists are legally required when we consider that something might be at risk. And I think staff in the MOMS program is very well trained to be able to understand what is an intrusive thought versus what is an intent. So I think there's been times when, rare times when we've had to have CPS be involved, but most of the time we've been able to understand if this is what we consider an ego-dystonic thought, and most of the times just a deep fear that something like that is going to happen. And I think that's the key for providers to understand, that having the thought doesn't mean that there's an intention.
So Dr. Fishman, it's me, Nirmaljeet. So I think it's the opposite. We often reach out to CPS to notify them that this is a waste of their time, and that they should actually leave the patient alone. And the few times that I've worked with CPS on inpatient unit when they were involved for, and it's interesting, I've never had a CPS, I have never myself called CPS for any patient who's had intrusive thoughts in the 11 years that I've worked in MOMS.
Correct.
So there is, honestly, I think little to no reason to do that. But when CPS has been involved, and these are not, I wouldn't say all of them are MOMS cases, but they were different cases, and I don't want to go into examples. What I try to do is to get CPS to help us, and I've often realized that their resources are so limited and they're stretched so thin that there's little that they can do to help the patient. But I think overall educating the moms about the whole process and why there is an organization like CPS is important, because it helps de-escalate their anxiety.
So that's all the time we have today, but I want to say another thank you to our panelists for your incredible contribution. Thank you for being here.